Hello, my name is Emre Kalyon. I am a senior software specialist with a demonstrated history of working in the banking industry. I am an expert in COBOL and I have knowledge of .NET Framework, C# and with thanks to my teachers at Master's Degree Program at MEF University, I have also knowledge of Python, machine learning and IoT. This is a video about my Capstone project in Information Technologies Master at MEF University. Nowadays, lumbar and cervical hernias have started to be seen very frequently. With the effect of various factors in the home and work environments, especially inactivity, spinal disorders have increased and became a major health problem. Lumbar hernias are more common since the center of gravity of our body is close to the lumbar spine. In such cases, a specialist should be consulted as soon as possible and necessary examinations should be done. Clinical examination is very important in the diagnosis of hernia. The purpose of this study is to create a simple application which can evaluate the risk of a people having herniated disc with the help of machine learning. In this study, I worked with Professor Medical Dr. Kalyon, who is a specialist in physical medicine and rehabilitation, who helped me to determine the features necessary and take the labels. Lumbar disc herniation is a disease that physical examination, symptoms and findings on imaging technique do not always correlate with each other, so that some other instruments are needed in diagnosis. An accurate and specific diagnosis prevents the recurrences of low back pain and chronic spinal pain. In addition, it helps to differentiate the cases who do not require any surgical approach. The application will use machine learning methods to determine the risk. Because the rules of making diagnostics on this illness cannot be coded directly with if-else commands, evaluating the risk for this sickness is based on recognizing a pattern like doctors do. The application prepared with this study will help to people who doesn't give importance to their complaints about lumbar spine and thinks that has a low probability to be sick and doesn't want to go to hospital. With this application, people are going to be able to make a risk evaluation for herniated disc within just 5 minutes. This application can also be used as a decision support system in clinical examination. Human and equipment resources are very valuable in health sector. The application can help to filter who needs to see a doctor and take MRI or X-ray films or have a surgical operation. In the future, as the number of applications like this increase, resources in the health services will be used more efficient. Although the features required in this application is very easy to maintain, it is recommended to have someone's help for determining the features. The interface of the application is like this. The features are a straight leg raising angle on the right leg and on the left leg, the Bragard test, the pain level and the Achilles reflex. You can see a detailed video and how the features will be determined at this web address. It's www.tunçalpkalyon.com/ml for machine learning. You can see an explanation here to how to use the application, and this is a prepared video for how to determine the features necessary for the application. Let me describe the features basically. The straight leg raising test is like this. The leg is elevated with the knee extended, like this. At an elevation degree, pain is felt on the backside. This degree of feeling pain for both left and right sides are a feature for us now. You see, it's like 45 degrees here. The patient is feeling pain. And after that, you lower the leg, which pain is not felt, and pull the foot of the ankle upside. If the patient feels pain also, then the Berger test feature is recorded as true. Also, another feature is the patient is asked to evaluate the pain level between 1 and 10. This is also another feature for us. The Achilles reflex level on the side which had pain on the SLR test is compared with the side which had no pain. The Achilles reflex is tested like this. For 5 machine learning methods are tested in this study. The method with the highest accuracy is implemented on the application. All methods are tested with the default parameters and with hyper-tuned parameters. Microsoft Azure Machine Learning Studio is used to determine the best algorithm. The winner algorithm in this study is hyper-tuned boosted decision tree, and it is implemented for this application. Let me show you a short demo. For example, if you can lower your leg, if you can raise your right leg to 45 degrees and left leg to 30 degrees, and you feel pain, and after you lower your left leg to a degree that you don't feel pain and push up your foot, pull up your foot, if you feel pain and the Berger test is positive, your pain level is evaluated between 1 and 6, and if you have diminished Achilles reflex, you enter 1. If you evaluate this, the application says that you have a high risk of herniated disc. You can see a demonstration of the features also, and demonstration of the application in this web address. This study shows that with these features, straight leg raising test, Berger test, evaluation of pain in visual analog scale, and Achilles reflex, the consistency of diagnosis of herniated disc is actually high. Due to legal issues, evaluation of this application cannot replace the evaluation of a doctor and can only be used for initial advice. The results of this application can be used for people who is not sure to go to hospital for their complaint. The application can also be used to prevent unnecessary visits of the hospitals. This study also shows that such applications with machine learning can help to maintain health services for a variety of people. What machine learning does is recognizing a pattern of case, which is what doctors actually do in establishing the diagnosis.